Okay, so good afternoon, everyone. Good day, mom. Good day, class. So we are the group 3, the reporter for this video recording reporting. Well, I am Jumel Macasibalios, and together with my group mates, Miss Canillo Kathleen and Consolacion Syra Jane. Well, our topic for today is all about the urinary tract infections, or the infections of the urinary tract. Well, urinary tract infections, or most commonly known as UTI, is an infection in any part of the urinary system. And by this session, by this record, we can dig deeper about what is UTI, and we will discuss here the common manifestation of urinary tract infection and the common pathogens, or what are those pathogens that causes urinary tract infection, as well as we will know the appropriate laboratory diagnosis and treatment of these infections, as well as we will propose measures by which urinary tract infections can be prevented. So, but before anything else, let me present to you our learning objectives. Okay, so our learning objectives at the end of the lesson, students can A. Recognize common manifestations of urinary tract infections. B. Differentiate an upper urinary tract infection from a lower urinary tract infections. And C. Characterize the common pathogens causing urinary tract infections. D. Discuss the appropriate laboratory diagnosis and treatment of each infection. And E. Propose measures by which urinary tract infections can be prevented. So, these are our learning objectives that we are hoping to attain, class. Okay, so among the most commonly encountered infections are the urinary tract infections. Well, community-acquired UTI is more common in women and are mostly uncomplicated. So the question is, why does the UTI is more common in women than men? Okay, so because of that, this is due to the shorter urethra and the proximity of the anal opening to the urethral orifice in females. So, in hospitalized patients, UTI usually develops as a complication of prolonged urethral catheterization, while making it harder to treat because most are resistant to various antibiotics. So, by this community-acquired UTI, which is mas common siya na sakit sa women, sa mga kabayan, rather than sa mga men, sa mga kalagayan, because sa katong mas duol or mas shorter ang urethra sa babae, maong mas dali makasaka ang mga bacteria or microorganisms nga gikan sa anal opening. Then, the urinary tract is usually protected from pathogenic organisms by the frequent flushing action of urination and by the constant sloughing of the epithelium. So, the acidity of normal urine also inhibits the growth of many microorganisms. In most cases of UTIs, the causative organism is derived from the flora of the colon. So, there are two routes by which bacteria can reach the kidneys. So, first we have through the bloodstream, and second we have the Second, we have the ascending infections from the lower urinary tract, which is the most common route is by ascending infection. So the most common route of this is the second one, the ascending infection from the lower urinary tract. Well, here we will discuss the common manifestations of urinary tract infections. So first, we will recognize the common manifestation of urinary tract infections. Well, urinary tract infections or UTI, as what I've discussed or mentioned earlier, that it is an infection in any part of the urinary system. So the urinary system includes the kidneys, the ureters, bladder, and the urethra. So this is a part of the urinary system. So most infections involve the lower urinary tract, which is we have the upper lower urinary tract and the lower urinary tract. So in the lower urinary tract, we have the bladder and the urethra. Well, women are at greater risk of developing a UTI than are men. So as I've discussed or I mentioned it earlier, why does mas greater ang risk sa mga babae kaysa sa mga lalaki in terms sa UTI or sa urinary tract infections. So, if an infection is limited to the bladder, it can be painful and annoying. But serious health problems can result if a UTI spreads to the kidneys or in the upper urinary tract. Well, by that, healthcare providers often treat urinary tract infections with first you have the antibiotics. So in antibiotics, you can also take steps to lower the chance of getting UTI in the first place. So, isa sa mga kuan sa mga healthcare providers which is ang pag-treat by the urinary tract infections as by taking antibiotics. So by this antibiotics, by the help of antibiotics, we can prevent of having or getting a UTI or the urinary tract infection. So by that, so here are the symptoms of the urinary tract infections. Well, UTIs don't always cause symptoms. When they do, they may include first of the symptoms that we can observe when we have or we can get the UTI is that a strong urge to urinate that doesn't go away. So I know that mostly of us, not so, but I think experience na aning kind of the symptoms. A strong urge to urinate that doesn't go away. So as like what I've experienced, for example, mangihi ka tapos imo jung kanang pugsod og ihi pero walay magawas. So that is one of the symptoms of the UTI. So second, we have a burning feeling when urinating. So this is one of the symptoms of UTI. Kana manghalang imuhang private part of times nga manghid ka. So this is one of the symptoms nga atong maobserbahan or atong ma-experience if maka-acquire ta aning infections. So third, we have urinating often and passing small amounts of urine. So as like what I've said sa first, which is kanang ayuhon mo ihi pero walay mo gawas, pero ari kanang naay mo gawas pero nagigagmay lang, dili siya totally nga daghan kay nga mo gawas nga urine gikan sa imong private part. Well, next of the symptoms of this UTI is the urine that looks cloudy. So this means if kana manghi ka kana ima bitaw ihi or imong urine is cloudy color, kanang colored kay siya like yellow or kanang naghilo imong ihi. So this is one of the symptoms of UTI. So next, the urine that appears red bright pink or cola-colored, which is signs of blood in the urine. So another symptoms of urinary tract infections is that kanang iniihi mo nga kanang something red na siya, which is color red, bright pink or cola-colored. So this symptoms is a sign of naay blood ang imuhang urine. So another symptoms is that this strong smelling urine. So it is one also nga simptomas sa UTI kana bitang isog kaayo ang baho sa imuhang urine. Next, the pelvic pain, which is here in women, especially in the center of the pelvis and around the area of the pubic bone. So kanang magsakit siya, something kanang sakit kay imong part sa lower part sa imong body if time ka manghika. So last symptoms of this in older adults, UTIs may be overlooked or mistaken for other conditions. So those are the symptoms of the urinary tract infections, which is ato ang ma-experience if maka-acquire ta ani nga sakit. So next we have the types of urinary tract infections. Well, each type of UTI may result in more specific symptoms. So the symptoms depend on which part of the urinary tract is affected. So as like naatay gitawag sa ato ang urinary tract, we have the upper urinary tract and the lower urinary tract. So each type of UTI na siya more specific symptoms from upper part o sa lower part. So nakadepende siya ang symptoms kung siya na affected. So it is the part of urinary tract affected and the signs of symptoms. So first we have the kidneys. So here in kidneys, it is part of the upper urinary tract. So first na symptoms na ato ang ma-acquire or ato ang kuan is that the back or side pain. So this is one of the symptoms in terms of where's the part of urinary tract affected. Specifically the kidney. So mas kung maapektuhan na itong kidney, one of the symptoms nga ato ang ma-experience is the back or side pain. Next we have the high fever. So high fever is one of the symptoms of urinary tract infections, particularly if mas naapektahan ang ato ang kidney. Next we have the shaking and chills. So kanang something connected siya sa high fever nga magkurog na ka tapos kanang tugno kay ang lawas, something dili masabtan ng gibati. And also we have the nausea and vomiting. So this is kanang something ludo na kadayon tapos magsuka ka or something nga mahing-ana nga mga infection nga mga symptoms nga ato ang ma-experience if affected sa urinary tract infection ang ato ang kidneys. So next we have the bladder. So bladder, which is part of the lower urinary tract. So ato ang ma-experience ani nga symptoms in terms of mapiktahan natong bladder sa UTI is the pelvic pressure. Well, in this ang pelvic pressure kauban siya sa lower belly discomfort sa ato ang parts atong bladder, that something nga magsakit siya, frequently painful urination, if time nga mangihi ka, sakit ka imong puson, sakit kaayo ang parts sa imong lower urinary tract. And also, the last symptoms of this, which is ang bladder mapiktahan sa UTI, is the blood in urine. So as like atong mentioned ganina, nga one of these symptoms is that kanang mag-red, color red imong urine, which is nag-specify na siya nga naay dugo, naay blood. So next we have the urethra. So here in urethra, so one of the symptoms if the urethra is affected by the UTI is that the burning with urination discharge. So this is a common na symptoms nga ato ang ma-experience if naata ani nga sakit, ani nga UTI if maka-acquire ta ani. Well, the causes. And by this, UTIs typically occur with bacteria. No, the bacteria enter the urinary tract through the urethra and begin to spread in the bladder. So the urinary system is designed to keep out bacteria. But the defenses sometimes fail. That's why mas ma-affect na ang kanta, ma-infected ka ani, because when that happens, bacteria may take hold and grow into a full-blown infection in the urinary tract. So if ang defense nato nga dili dili siya something nga makalaban sa bacteria if kusog kayo or isog kaayo ang mga pathogens, ang mga bacteria nga isa ka sa imong urethra, may epektahan na siya. Maunang mas mukuan sila, mo grow sila, ma-inhibit sila og ayo, tapos mas ilahang ma-infectionan ang urinary system. So first, dara na is the urethra, tapos musaka siya into our bladder. So here the infections of the bladder. Well, this type of UTI is usually caused by Escherichia coli or E. coli. Well, E. coli is a type of bacteria which is commonly found in gastrointestinal tract. But sometimes other bacteria are the cause. So it's, commonly nga cause aning infections ng bladder or sa UTI is that maka-occur na ng UTI because of the E. coli, but not na E. coli lang ang isa sa mga cause ani. Daghan pa kaayo nga bacteria, daghan pa kayo mga pathogens ang cause nga nung maka-acquire ta og UTI. Well, here, having sex also may lead to a bladder infections, but you don't have to be sexually active to develop one. All women are at risk of bladder infections because of their anatomy. And women, the urethra is close to the anus. That's why the urethral opening is close to the bladder. So this makes it easier for bacteria around the anus to enter the urethra and to travel to the bladder. So by this, isa sa mga maka-infection is that ang kanang makipag-sexual intercourse ang sa katawo, which is may lead into a bladder infections because dili totally ang tanan nga imong ka-partner anak nga intercourse kanaw limpyo. So even though you are not a sexually active, maka-develop gihapon ka og UTI or maka-acquire ka ani because specifically sa women, because ang kanang women is that tungod sa silang anatomy, sa women anatomy, because mas duol ang urethra sa ilang anus. That's why mas paspas, mas dali makasaka ang mga microorganisms or ang mga pathogens nga gikan sa anus paingon sa ilang urethra. So even though dili ka sexually active, possible nga maka-acquired ka ani nga sakit. So here we have the infection of the urethra. So this type of UTI can happen when GI bacteria spread from the anus to the urethra. So an infection of the urethra can also be caused by sexually transmitted infections. So they include herpes, gonorrhea, chlamydia, and mycoplasma. So this can happen because women's urethras are close to the vagina. So one of these causes, which is the infection of the urethra, is that ang katong mga gastrointestinal bacteria will spread gikan sa anus paingon sa urethra. But the infection of the urethra, which can also caused as well by the sexually transmitted infections. So those infections nga katong mga bacteria nga nisulod, so they can include mga herpes, gonorrhea, chlamydia, and mycoplasma. So because of that, so katong greater risk ang women sa UTI kaysa sa men because balik-balik na to nga discuss or mention because the woman urethra are close to the vagina. So by that, mas paspas, mas dali maka-spread ang mga pathogens. Tapos makasaka sa urethra din mo, kumusaka sa bladder, tapos mukalat na siya sa urinary system. Maunang ma-infection ang urethra. So the risk factors. So here, UTIs are common in women, and many women experience more than one UTI during their lifetime. So, mas greater risk, mas common ang women maka-acquire ng UTI kaysa sa mga lalaki because they experience mas katong many women mas ma-experience sila more than UTI during silang whole life. Mas greater risk ang makuha sa mga babae in terms sa pag-acquire ani nga sakit rather than sa mga male, sa mga laki. Well, here the risk factors for UTIs that are specific to women include first, the female anatomy. Well, women have a shorter urethra than men do. As a result, there's less distance for bacteria to travel to reach the bladder. So here, mga risk factors sa UTI nga makuan sa mga women. So ang usa sa mga dari ilang female anatomy because mas shorter ang ilang urethra kaysa sa men. So tungod ani mas mubo ang distansya sa bacteria para mo travel from their anus to the urethra and mo spread siya sa urinary system. So next, the sexual activity. So being sexually active tends to lead to more UTIs. Having a new sexual partner also increases risk. So being sexually active also mas makalead siya sa maka-acquired og UTI, especially if dili lang usa ang imuhang ka sexual intercourse ug daghan siya, so mas increase, mas taas og risk nga maka-acquired ka ani nga sakit. So next we have the certain types of birth control. So certain types of birth control, so using diaphragms for birth controls may increase. The using spermicidal agents also can increase risk of having these infections. So by the use of diaphragms, for having birth control, which is isa siya sa mga factors nga makahatag siya sa mga women nga risk sa UTI. Because using spermicidal agents, by using of these kinds of agents, it can also lead into the increased risk of UTI by the women. So here we have the menopause. So menopause, after menopause, a decline in circulating estrogen causes changes in the urinary tract. So the changes can increase the risk of UTIs as well. Then other risk factors for UTIs include, first we have the urinary tract problems. So babies born with problems with the urinary tracts may have trouble urinating. So urine can back up in the urethra, which can cause UTIs as well. So next we have the blockages in the urinary tracts. So kidneys, stones, or any enlarged prostate can trap urine in the bladder, ang mga kidney stones. So as a result, risk of UTIs is higher. Because i-block man niya ang ahamuagi ang atong ihi. So that's why if ma-block man niya, mas hugaw sa sulod, mas taas ang risk sa UTI nga maka-acquired tag UTI. So a suppressed immune system. Well, diabetes and other diseases can impair the immune system, so the body defends against germs. So this can increase the risk of UTIs as well. So it is also one of the risks of getting a risk factor of getting UTI, specifically sa women. Um, so by this, the suppressed immune system can increase the risk of UTIs by women. So next we have the catheter use. So by using catheter, people who can't urinate on their own often must use a tube, which called a catheter. So kabalo ko nga we are all familiar about what is catheter is o kung say ang use sa catheter. So this the catheter will use to urinate. So by using catheter, it can also increases the risk of UTIs. Why? Nganong if magamit tag catheter, mas mo taas man ang risk factor nga maka-acquire tag UTI. Well, because of using catheters may be used by people who are in the hospital. So they may also be used by people who have neurological problems that make it difficult to control urination or who are paralyzed. So mas taas siya ang factors nganong mas mas ma-increase nimo, mas ma-increase ang risk nga makakuha UTI because sa paggamit og catheter, because if ang usa ka tawo, usa ka patients in the hospital were use this kind of method or kining gamit, sa hospital daghan kay mga tawo nga nagamit og mga anasab. So mas daghan o possibly nga mas ma-infect ka because naka sa hospital daghan kay ang sakit nga ma-acquired. So meaning, the problem of this is that it is difficult to control urination. Then in that daghan nga mga sakit nga imuhang makuha. Then by that daghan po ng tao nga mogamit ana. So specifically if we are not ang gamit sa kanang catheter is that isa lang or something nga kanang ang kana siya kay kanang mas daghan ang ning-gamit ana siya nga gamit. So bali mas mutaas ang inyahang ang risk sa paggamit ana because daghan ang tao nga nakagamit ana nga catheter. So by that mas mataas yun ang factor nga maka-acquired ka og UTI. Next we have the recent urinary procedure. So urinary surgery or an exam of urinary tract that involves medical instruments can both increase the risk of developing a UTI. So ang katong mga medical instruments, katong mga gamit nato which is ang mga gamit sa hospital nga kadalasan ginagamit tapos wala kay sakto nga sterilize of paggamit ana nga procedure if naa ka nag-urinary surgery ka tapos wala kay ang mga medical instruments wala kaayo siya na sterilize, then mas mo-increase ang risk sa pag-develop sa UTI. Next, the complications. So, when treated promptly and properly, lower urinary tract infections rarely lead to complications, but left untreated, UTIs can cause serious health problems. Ang UTI can cause talaga og serious na health problems because it is not kanang kuan lang, it is not a sakit lang, but these infections it is harmful sa atoa og serious kayo ang health problems ani nga atong ikuan if ato ang makuan if maka-acquire ta ani nga sakit. Well, complications of a UTI may include repeated infections, which means you have 2 or more UTIs within 6 months or 3 or more within a year. So women are especially prone to having repeated infections. permanent kidney damage from a kidney infection due to an untreated UTI, delivering a low birth weight or premature infant when a UTI occurs during pregnancy. So, this is the complications of the UTI, no? If we deliver of a woman, deliver siya of low birth with sa usa ka premature infant when a UTI occurs during pregnancy. So if kanang kuan if a woman is pregnant, then naa siya ani nga sakit UTI. So pag deliver ana siya nga bata is that ang infant, ang premature infant is gamay siya timbang, no? Kanang murag something paggawas pa lang sa bata, paggawas sa anak is that kanang gamay kitimbang niwang kayo something because of the complication of UTI, specifically sa women, no? So, narrowed urethra in men from having repeated infections of the urethra. So, it is one of the complications of a UTI. So, next we have the sepsis. So, sepsis, a potentially life-threatening complication of an infection, specifically sa UTI. So, this is a risk, especially if the infection travels up the urinary tract to the kidneys. So sepsis, no, it is life-threatening. It is harmful sa ato if kini nga complication na sa aning infection, which is if maka-travels na siya from urinary tract to the kidneys, mas harmful siya, no, sa upper urinary tract, mas life-threatening siya nga complication sa tuha. Maong dapat we are aware sa itong mga actions sa ato ang mga ginabuhat, o dapat kanang hygienic tas tong lawas, no, para wala kay mga pathogens, wala nga mga bacteria nga atong ma-acquired maoy magka-cause nga maka-develop ta ani nga sakit. So here, the difference between upper urinary tract infections and lower urinary tract infections. So by this, the question is, what are the difference between a lower and upper urinary tract infections? Urinary tract infections can affect anyone of any age. So this is why it is important to know the signs and symptoms of UTIs and the differences between upper and lower urinary tract infections. So the good news is that in most cases, the problem is diagnosed quickly and treatment given to resolve any issues with pain and frequency of passing urine. So below, we explore these differences and what you need to look out for. So the urinary tract infections can be divided into upper and lower part or sections. So here, the difference between upper urinary tract infections and the lower urinary tract infections. So first, we will discuss what is upper urinary tract infections. Upper UTIs are not as common as lower UTIs, but still good to know what to look out for so that you can seek help. So an upper urinary tract infections mainly refers to the kidneys and the tubes that lead from the kidney into the urinary bladder. So just look at the pictures. Look the pictures. So this pictures depicts the upper urinary tract infection. So here it is mainly refers to the kidneys and the tubes that lead from the kidney into the urinary bladder. So that is the upper urinary tract. So a urinary, these tubes are called the ureters. So by the kidney, then these tubes is called ureters. So urinary infections of the kidneys is referred to as pyelonephritis. So if a kidney or the upper urinary tract infections will be infected, so that infection is called the pyelonephritis. Well, symptoms can include lower back pain, that may severe nausea, vomiting, and a high fever. So, usa sa mga symptoms if ang kidney na mo ay infected is that katong ako mentioned earlier is the lower back pain, no? Severe. That may be severe, nausea, vomiting, and a high fever. Tapos doy, katong manugnaw ka, tapos init kay ka, tapos mamugnaw ka, tapos amo ni ang mga symptoms if ma-infected ang upper urinary tract, specifically ang kidneys. So, the difference between upper urinary tract to lower urinary tract, so sa upper, adira siya na belong ang kidney, ang kidneys, tapos ang tubes, then paingon sa bladder. So the upper urinary tract consists of the kidneys and ureters. An infection to any of these is termed as upper urinary tract infections. So infections of the kidney, which is called pyelonephritis, is extremely dangerous and is manifested by pain in the lower back, fever, chills, nausea, and vomiting. So pyelonephritis is extremely dangerous. No? It is extremely harmful if ma-infeksyonan ang kidneys, which is ang upper urinary tract. So, this warrant an immediate visit to the doctor if observe na kaani nga symptoms nga imong na-experience, no, dapat pag mo ka og medical assistance, maadto na ka sa doctor, maadto na ka sa hospital kay this infections, the pyelonephritis, is extremely dangerous, which is daot isa sa tua, makakuha mga symptoms, mga fever, chills, nausea, and vomiting. So if the infection spreads beyond the kidneys into the blood, it can result in septicemia. So these cases are treated by administering intravenous antibiotics. So for that, naatay mga antibiotics. So usa ta mainom og mga antibiotics, dapat di ta pataka pag inom because dira pod maka-resist nino ang mga bacteria because nagpataka tag take og mga antibiotics. So dapat mo adto sa gidta sa hospital, sa doctor, para matagaan ta og mga resita if unsa nga mga antibiotics or treatment nga atong imnon para nga maayo ta maayahang matambalan ang kini nga sakit. So next we have the lower urinary tract infections. Well, a lower urinary tract infection refers to the inflammation and infection. It refers to the infection of the bladder and the urethra, so which is the tube that leads from the bladder, enabling urine to exit the body. So women are more prone to lower UTIs than men because of katong mas duol ang urethra sa bladder sa women kaysa sa lalaki. So cystitis refers to inflammation of the bladder and urethritis refers to inflammation of the urethra. So the lower urinary tract infection, so if ma-infected ang lower urinary tract, specifically sa ang bladder, ang urethra, o ang tube nga leads from the bladder, no? Para atong gamiton sa kanang mo exit ang atong ihi sa atong lawas. So kini nga lower urinary tract infections na atay ang sa bladder nga ma-infection kanang ma-infected ang ato ang bladder natay gitawag og cystitis or cystitis. So mo na ang inflammation sa tong bladder. So sa to ang urethra natay urethritis og natay prostatitis sa men. So that inflammation of the urethra, which is typically also dangerous, extremely dangerous or harmful if ma-infected ang atong lower urinary tract. So the bladder and the urethra together form the lower part of the urinary tract. Infection of the urethra, which is the urethritis, ang infection sa urethra, infected ang urethra, ang gitawag og urethritis. Or sa bladder, we have cystitis. So it is manifested as burning during maturation, increased frequency of urination, dark and smelly urine, and blood in urine. So those, and also we have the cloudier urine, katong magyelo, then pelvic pain in women and rectal pain in men. So with that infections, both urethritis and cystitis, we can experience a symptoms, daghan kay nga symptoms nga ato ang ma-experience if infected both ang ato ang bladder o ang urethra. So by that, daghan kay symptoms, we have the dark and smelly urine, kanang time na maghilo kay itong ihi, tapos kanang something nga mas strong ang iyang baho, then naghilo, tapos napay time, napay part nga kanang nagkaan siya color red na siya blood. So the lower UTI cases are treated by administering oral antibiotics. So by that, ang kana nga mga cases, ana nga mga infections, we can also treat it by taking oral antibiotics or those antibiotics nga atong ginainom atong i-take. So by that, which is not mean also nga dapat if maka-experience ta ani nga mga infections, ani nga mga sakit kay mo inom pud ta dayon og bisag unsa nga antibiotics, which is big no, bawal siya because need ta mo adto og doctor, mo seek tag medical help, for us to be guided, for them to aware us unsa ang ato ang dapat i-take para matambalan ni nga mga infections or nga ning mga symptoms ng dala sa urinary tract infections or UTI. Because if magpataka tag inom, magpataka tag take og medicines na apay time nga ang kana nga mga bacteria, kana nga mga pathogens which is strongly can resist those antibiotics nga makakos na inuon nga mas mo inhibit sila o the inhibition of the pathogens, which is mas kusgan sila na mas mukatag pahinuon sa atong urinary tract, sa urinary system nga mas makahatag inuon og risk sa ato ang lawas, So dapat first tunghaton is that if makakanta aning symptoms, dapat moadto ta sa hospital o magpatingin ta sa mga doctor. Well, here the signs and symptoms of a urinary tract infection. So here's what you need to look out for you if you suspect that you have a lower urinary tract infections. So one of the biggest symptoms is that you will be passing urine more frequently, and this is often accompanied by a burning sensation. The urine is also often smelling, then cloudy, and you may be able to see blood. So this is the sign and symptoms of the urinary tract infections. So many people also complain suffering from lower back pain, specifically the elderly people who have a lower urinary tract infection may also appear confused and agitated. So those are the symptoms of urinary tract infections, And I know not mostly of us, but kabalo ko nga, especially sa ako nga naka-experience ko ani nga nga sakit, nga infections, no? Mo dapat natay mga trabaho to doctor, no? Kay kung patakatag inom og mga tambal, patakatag kuan og mga medication, mas basin di ay basin pa food ka mas mo harm pa noon, mas mo lala pa noon ang atong kahimtang. So here we have I will discuss the common pathogens causing urinary tract infections. No, what are those common pathogens causing urinary tract infections? So, what are the common pathogens of urinary tract infections? No, unsa tong mga common nga mga bacteria nga mao'y nakakause sa urinary tract infections. So, first we have the Escherichia coli. So, E. coli. So, I know nga, gabalo na ta, natin idea what is E. coli mean because this bacteria is common, no? Common siya sa mga sakit-sakit, sa mga diseases nga sa mga tao. So, kini nga E. coli is the most common bacteria which found to cause UTI is E. coli. So other bacteria can be cause UTI, but E. coli is the culprit about 90% of the time. Urinary tract infections or UTI are a severe public health problem and are caused by a range of pathogens, but most commonly by E. coli, no? Then we have also the Klebsiella pneumoniae, the Proteus mirabilis, Enterococcus faecalis, and Staphylococcus saprophyticus. But most common, no, murag something around 1 yun siya ang E. coli na mag-cause siya sa UTI. Well, E. coli, which is normally lives harmlessly in the human intestinal tract, but it can cause serious infections if it gets into the urinary tract. So in women, the trip from the anus to the urethra is a short one. This is the reason why wiping from to back after using the toilet is helpful in preventing UTI. Well, Escherichia coli is a gram-negative bacillus that is part of the normal microbial flora of the human body, specifically the colon hence. Specifically the colon, which infections are endogenous. It is a member of the family Enterobacteriaceae. So improper washing after defecation is a factor that promotes entry of the organisms into the urinary tract. Then most especially in women because of the proximity of the urethral orifice to the anal opening. It is the most common cause of community-acquired UTIs. So, the E. coli, it is common na mga pathogens. It is one of the most common pathogens nga makakause siya sa UTI. So, dapat physically hygiene ta, dapat limpyo ta mente para dili ta maka-acquired ani nga mga pathogens mamoy hinungdan nga maka-develop noon ta og mga UTI or mga urinary tract infections, no? If makasaka siya ang pathogens gikan sa tong anus, specifically sa mga women, which is mas taas sila og risk nga maka-acquired sila ani rather than sa mga men. So next we have the Proteus mirabilis. Well, Proteus mirabilis is are a gram-negative bacilli that are members of the family of Enterobacteriaceae. So the organism produces urease, which causes alkalinization of urine, making the patient more prone to development of urinary stones, no? Stones. So this is one of nga mao yung hinungdan nga ang patient no nga maka-develop siya mga urinary stone because of these pathogens, Proteus mirabilis. Well, it is the second most common cause of community-acquired UTI, and it is a major cause of nosocomial infections. So this type of pathogens is a common pathogens that causing urinary tract infections, the Proteus mirabilis. No, it is prone siya sa mga patient nga na maka-develop noon og mga urinary stones, no? Which is if maka-develop kag urinary stones, mas taas, high risk nga maka-acquired ka og UTI. So this is the factor mao ni ang hinungdan kini nga mga pathogens, the Proteus mirabilis. So first one no, natay gitawag og E. coli, and next the Proteus mirabilis. So next we have the third one, the Serratia species. So Serratia species are also gram-negative bacilli that belong to the family of Enterobacteriaceae. So these organisms are major entities in nosocomial infections. So almost of these infections will cause immunosuppressive therapy or mechanical manipulations of the patient. So the most frequently isolated species is Serratia marcescens. So the organism produces a bright red pigment called prodigious, in which imparts a red color to the colonies. So it is also associated with outbreaks of UTI. So once infections, pneumonia, and septicemia. So this Serratia SPP is one of the common pathogens why we can develop or we can acquire UTI. So kauban ra siya sa E. coli, Proteus mirabilis, kini nga mga pathogens na maka-acquire ta because of this mga bacteria. So next of the common pathogens causing of urinary tract infections, we have the Enterococcus faecalis. What is Enterococcus faecalis? No, just look the picture. So this is the structure. No, this is the muni ang nawang sa pathogens. So gitawag nato ang Enterococcus faecalis. So ang Enterococcus faecalis, no, it is a enterococci, a part of the normal enteric flora, so belonging to the family of Enterobacteriaceae. No, it is also a part the family sa Enterobacteriaceae, kauban sa Serratia, Proteus mirabilis, o Proteus mirabilis, o sa E. coli. So these pathogens will grow in 6.5 and are more resistant to penicillin G. So Enterococcus faecalis is the most common among the enterococci. So these are also frequent causes of nosocomial infections. Then, particularly in intensive care units, enterococci are transmitted from one patient to another, which is primarily from the hands of hospital personnel. So in patients, the most common sites of infections are the urinary tract, then once biliary tract, and blood. So in urinary tract infections, enterococci are usually cultured along with other species of bacteria. So these pathogens, or these common pathogens where a cause of urinary tract infections is a part of sa family nga Enterobacteriaceae. So these kind of pathogens will transmitted from one patient to another. Specifically, no, if ma-hospital ka, if naa ka sa hospital, then because for example, sa hands, sa kamot, sa mga nurse, sa mga doctor, or sa mga gamit nga wala kaayo siya something and sterilized, then maka-transmit siya, mabalhin siya from with that, maunang isa sa mga common yung mga pathogens nga nung maka-acquired ka og UTI. So that is the Enterococcus faecalis. Next, we have another pathogens which is common nga nung makakuanta og UTI, the Staphylococcus saprophyticus. So Staphylococcus saprophyticus is most patients with it is a gram-positive coccus and a common cause of urinary tract infections, no? In sexually active young women. It is a common colonizer of the urinary tract, so we can get these pathogens by having a sexually active, specifically if imong partner kay hugaw, dili siya limpyo, then so if magbuhat mo intercourse sa imong partner, dapat limpyo, then magamit ta og mga protective measures na siya. So for that nga dili ta maka-acquire this kind of pathogens. So this common, no, kay isa sa mga hinungdan nga nung maka-acquire tag UTI because of sexual intercourse. No, so common siya, isa sa mga kini nga mga pathogens, Staphylococcus saprophyticus. Well, next we have the pathogenesis. So in most patients with urinary tract infections, the infecting organisms is derived from the patient's own fecal flora. So there are two routes by which bacteria can reach the kidneys. So first we have through the bloodstream, and second we have from the lower urinary tract, no? It's common specifically, no, sa ascending infections. So ascending infections is the most common cause of clinical pyelonephritis. So the infection pyelonephritis is one of the infection sa ato ang kidneys, no, sa upper urinary tract. So the infection begins with colonization of the distal urethra and introitus by the invading organisms. So the organisms then ascend to the urinary bladder. Instances that can cause incomplete voiding of the urine can lead to urine stasis, allowing the bacteria to further multiply. If time nga manghihita tapos dili nga manghihita tapos dili kay kompleto nga atong magpagawas tanan, so hinungdan nga nung mas multiply the inhibit growth of the pathogens dito sa ato ang bladder. Well, chronic infection leads to ascent of the organisms to the kidneys, which leading to the development of an upper urinary tract infections. So all portions of the urinary tract may be involved in the infection. So we have this cystitis, inflammation of the urinary bladder. So sa kidney, we have this infection, the pyelonephritis, then sa ato ang urinary bladder, we have this cystitis. So it is the most common type of urinary tract infections, and it is most commonly caused by E. coli. So no, ang common na mga pathogens nga nung naka-acquired ani because of E. coli. Then other common causes include Proteus, Klebsiella, Enterococcus, Pseudomonas, Enterobacter, Staphylococcus saprophyticus, and lastly we have the Staphylococcus epidermidis. So this is the common pathogens why we acquired UTI, no? Sila ang mga hinungdan, sila ang atong mga pathogens nga nung naka-acquired tag UTI. So, and Candida albicans, the inflammation of the urethra is called urethritis, no? Ang infection sa atang kidney natin gitawag og pyelonephritis if may epektuhan ang ato ang kidney sa UTI, no, factor. Next, then sayo na ata sa gitawag sa bladder, we have the cystitis, and then sa urethra natin gitawag og urethritis. So the organisms involved are usually sexually transmitted. So the common causes of which are Neisseria gonorrhoeae and Chlamydia trachomatis, which is non-gonococcal urethritis or NGU. So this inflammation of the kidneys, particularly of the tubules, is called pyelonephritis, no, sa kidney. Then katong mga tubes which is paingon sa bladder para sa katong from the bladder dito mo gawas ang ato ang mga sa atong urine. Then the most frequent cause is that the E. coli, it is most often is the result of the ascending infections. But the offending organisms may also reach the kidneys through the bloodstream. So those infections, pyelonephritis in the kidneys, then naatay daw sa histiocytitis sa atong bladder o urethritis sa atong urethra, is that the common causes of that is the E. coli, which is also we can get it by usually sexually transmitted. If you are sexually active, then it is one of the factor why maapektuhan, why maka-acquire ta ani nga mga sakit, then maapektuhan atong kidneys, atong bladder, atong urethra, then it will lead to urinary tract infections. Now here we will discuss about the appropriate laboratory diagnosis and treatment. Then with that urine, we have the diagnosis of about what is the appropriate laboratory treatment of this infection. So first, we have the urinalysis. So urinalysis is one of the most, oldest clinical laboratory procedures, which is the urinalysis. It is one of the diagnosis of or treatment or diagnosis, appropriate diagnosis infections. Diagnosis we will acquire this infection. So this the diagnosis involves gross observation and assessment of general appearance of urino. Just try to look at the picture, no, mas na siya ang urine ang ato ang ihi kay mura siya gi-obserbahan. Well, with that, the appearance of the urine, just look the color, cloudy, which means yellow siya, kanang yellow kaayo, which is dipstick analysis and microscopic examination. Examination will firm what's the form of the elements in the urine. So it is one of the most commonly performed laboratory tests. At the diagnosis, the examination of our urine, in terms we will develop these infections, this UTI. So it is important that an appropriate specimen be collected. So we have the urine. Urine may be collected. So this diagnosis of the urine, which be examined by the doctors. Why anong naka-acquired ta ani nga sakit. So urine may be collected through the following methods. So we have the following methods that we will use by collecting our urine to be examined. So first we have a clean voided midstream technique. Then we have the suprapubic aspiration, third diagnostic catheterization, fourth from an indwelling catheter, and fifth we have the during cystoscopy, urethral catheterization, or retrograde pyelography. So this is the usual practice. Now this is the methods of collecting our urine. So the usual practice is to use the clean voided midstream technique. So this technique should be properly explained by the nurse or preferably the physician. So if possible, the instructions should be both verbal and written. Patients should be instructed to void so the first few milliliters of urine before beginning the collections. In most cases, the patient, male or female, should gently cleanse the urethral mucus with a swab and then arise. So with that, it is the method in collecting our urine. So to be examined, which is a under of the diagnosis, which is particularly sa urinalysis, which is the urinalysis is the one of the oldest clinical laboratory procedure nga ginabuhat to examine our urine if we will acquire those infections, no, if unsa na ba ang level sa ato ang UTI mo nang just look, no, na siya by colored, then ang ato ang urine gi-examine siya, tapos with that ma-identify sa mga doctor kung unsa nang level ang atong UTI, no, if harmful na ba kay siya. Tapos so with that tagaan nila og mga ang itong buhaton, awareness, treatment, specifically sa mga antibiotics nga ato ang i-take para matambalan nato ang ato ang sakit na UTI. So next we have the urine culture. So this urine culture is one of the diagnosis. It is one of the diagnosis, the appropriate laboratory diagnosis in terms to examine our urine. Then, with that, the usual practice, the urine culture, which is the urine culture, then the urinalysis results will only reveal the probability of urinary tract infections or not. While here in urine culture, the best method to diagnose urinary tract infection is to do urine culture. So by this, urine collections follows the same principles as in doing a routine urinalysis. Immediately after collections of the urine, the specimen should be sent to the laboratory where it should be examined within 15 minutes. So it will be examined in a 15 minutes. Then, with that, if the urine is made to stand at room temperatures without bacterial examination, in a matter of 2 hours, it will give a false positive culture. So this is one of the diagnosis or the appropriate diagnosis to examine if you acquired UTI by examining your urine. So with that, one of the appropriate diagnosis is the urine culture. The famous one is, or the oldest clinical laboratory procedures together with urinalysis. So it will examine our urine, and they will examine our urine for them to know what is the level of our UTI, no, an acquired UTI. So this is one of the appropriate laboratory diagnosis by para mailhan nila kung about sa atong sakit ng UTI, no, by pag-examine sa atong urine. Then next, we have the treatment. So the treatment is that any antibiotic eliminated by the kidney and to which the organism is susceptible can be used effectively and safely. Well, culture and susceptibility testing are important for pyelonephritis. Now, pyelonephritis is one of the infections that our kidney will acquire if we will have this UTI, and complicated cases like sa bladder, sa itong urethra. Then with that, and then the patient is not responding to the antibiotic therapy for uncomplicated infections with E. coli, which is E. coli is one of the common pathogens causing of urinary tract infections that recommended drug of choice. So we have the antibiotic treatment. So by this, if we will acquired urinary tract infections, na atay mga treatment kung unsa atong i-take para maayo ta sa atuan nga mga sa sakit nato sa specifically if ma-infected ang ato ang urinary system. Well, with that natay mga antibiotics. So the question is, what are those antibiotics that we will take in order for us para sa tua nga maayo ta. So next we have the trimethoprim sulfamethoxazole. So trimethoprim sulfamethoxazole is given 3 to 7 days for infections with Protost and Pseudomonas. So this is one of the treatment. So this antibiotics is one of the treatment, isa sa mga tambal nato if naatay mga UTI. So this is one of the prescribed sa mga doctor. Una dapat dili ta magpataka-taka og take og mga tambal if makakuanta na ang mga symptoms kay naa pa siya possibly nga maka-resist ang mga bacteria, ang katong mga pathogens. Mauna if inom na tag ka ng specific nga tambal about na sakit, dili na noon maayo ta because mas kusga na itong mga pathogens kaysa kay naka-resist naman sila. So dapat mo if makakuantaan nga mga symptoms of UTI, one of the best way that we will do is to go to the hospital or we will seek a medication para tagaan ta o mga iresita sa doctor kung unsa dapat ito i-take para matambalan na. So next we have, so that is trimethoprim sulfamethoxazole. Next we have the fluoroquinolone. So the fluoroquinolone, you just see the picture. No? This is muna ang tambal sa UTI. So fluoroquinolone is the antibiotic of choice in cases of acute pyelonephritis. Pyelonephritis is the infection of our kidney. So with that, fluoroquinolones are broad-spectrum antibiotics with good oral bioavailability. So their indications include treatment of urinary tract infections, then pneumonia, gastroenteritis, and gonococcal infections. Worldwide, fluoroquinolone use is increasing and has been associated with rising rates of resistance. So this is one of the treatment. So this is one of the treatment ng mga antibiotics na ato ang i-take if naata urinary tract infection. So or third generation, we have the cephalosporins. So this is cephalosporins, one of the antibiotics na ato ang i-take if naata ani nga infections. So maybe given for a period of 3 to 10 days. So kini siya nga antibiotics ato siyang i-take 3 to 10 days if naata ato nga mga symptoms sa UTI. So it can increase water intake, is also often advised to avoid dehydration. So just look at the picture. It is wide range of cephalosporins, fights bacterial infections effectively, and it improves spectrum activity with sulbactam. It is the cephalosporins antibiotics. I think it is one of the sakto nga mga antibiotics nga atong i-take if naata urinary tract infections. Now we will discuss about the measures by which urinary tract infections can be prevented. So what are those measures nga makapreventa sa urinary tract infection? So unsa atong pagabuhaton para ma-aware ta nga dapat din nato ni kini nga mga butanga para dili ta maka-acquire sa UTI. So Well, follow these tips to lower your risk of a UTI with little or no potential negative side effects, because it's always better to prevent an infection rather than simply treat it. That's why UTI are no different. That's why we should follow these tips to lower your risk of a UTI with little or no potential negative side effects. So this is the proposed measures by which urinary tract infections can be prevented. So first, one is to drink plenty of fluids, especially water. So this helps keep the bladder tissue hydrated and healthy. So this also dilutes your urine and lowers the concentration of bacteria in the bladder. So some people can clear an infection on their own just by drinking fluids. By drinking at least 50 ounces, about 1.5 liters of fluid daily to prevent infections. So this is one of the measures to prevent UTI, no? Dapat mo inom ta og daghan nga tubig. Kay para ang atong bladder di hydrated siya, tapos ma-dilutes niya ang urine, which is ma-lower ang concentration sa bacteria dito sa bladder. Because of that, maunang for example, no, kanang mukaon mga junk foods, especially katong mga chichirya nga atong ginakaon, dapat mainom tag daghang water para dili ta maka-acquired og UTI. Kanang mainom kanang excessive drinking of mga beverages, specifically katong mga Coca-Cola, kanang mga tamis kay nga ilimnon, tapos plus-plusan pa jud og kaon nato og mga sudan nato like mga noodles, pasit canton, tapos balik-balik, then plus mukaon pa tag mga chichirya, kanang atong mga tatos dira gipangkaon, then kanang mga chichirya. So dapat moinom ta og daghang water para maka-prevent ta sa UTI. So muni isa sa mga preventive measures para maka-prevent aning sakit, because no, some people can clear infections, no, if na sila ani mga symptoms, tapos ang ilang gibuhat is that nag-drink sila of plenty of water, dayon by that na-clear ang infections because of that. That's why drinking plenty of fluids is very important, especially if you can develop UTI. Next, we have empty your bladder often. So this is regularly emptying your bladder ensures urine is not sitting in your bladder for long periods of time. So meaning, if mag-drink tag water, dapat piminti pud ta mangihi. Piminti dili nato siya pugngan sa ato ang bladders. Kay if puggan nato, no, just try. I know nga kanang isa pud ta sa mga naka-experience ani, especially ako na-experience ko ani kini bitaw pugngan nato ang atong ihi. So you just kuana gani kung atong pugngan atong ihi, mas tingala ka magsakit imong diri nga puson nga part sa lower tract, tapos magsakit siya dayon lain na kaayo, tapos ihi bitaw nimo kay something maghilo na imong ihi kay imo mangipugngan mo. Dapat if kaihion ka, mangihi jud ka, bahal daghan kay mangihi kay mas okay no na siya, kay para gamay ang risk, no, nga maka-acquired ka og UTI. So that's why dili nato ato ang pugnan ang atong ihi, kung kaihon ka dapat ihi dayon. Then since bacteria like warm and wet environments to grow, this takes away good living conditions for the bacteria. It is normal to empty your bladder 4 to 8 times per day. So mangihi ta dapat kaupat taman sa ika-8, no, 4 to 8 times kada adlaw. So normal ra na siya manghita, mas healthy noon kay ang katong mga bacteria kay mas ganahan to sila mga warm o wet na environments, no, mas mag-grow sila sa sulod. So if ato silang maihi, so mawala siya. Then with that mas gamay atong factor, no, gamay ang risk nga makakuanta aning maka-develop tag UTI, no, specifically sa mga women kay kanang mga bayi gyud mas dali maka-acquire ani. So next we have to urinate to urinate son after sex, no? The act of intercourse can cause bacteria to get close to or into the urethra. So the small tube that empties your bladder, voiding after intercourse removes some of the bacteria before it can cause an infection. So, no, if makipag-sexually intercourse ang sa katao, if makipag-sexually intercourse, dapat after that mangihi gyud dayon. So it is one of the preventive measures or appropriate measures nga makapreventa para maka-acquire tag UTI, because if as like what I've mentioned earlier nga if makipag-intercourse kay ang bacteria mas close, no, specifically sa women dito sa urethra, then if that enters the urethra, then will spread siya into our bladder, tapos maka-infect na naman siya sa lalain nga part sa both upper and lower urinary tract. With that, if mangihita after mag-intercourse, no, sexually, especially if sexually active ka, so if manghihi ka dayon after sa sex, then it will remove some of the bacteria, no, before nga maka-infect na siya. So mas maayo nga mangihi inighuman. So another preventive measures which urinary tract can be prevented is that take cranberry supplements. So while cranberry supplements have not been shown in studies to prevent urinary tract infections, this is a reasonable biologic mechanism that using them could be helpful. If you would like to try this option, consider a concentrated over-the-counter cranberry supplement instead of cranberry juice. So it likely provides more benefit and reduces extra sugar typically found in juice. So with that, this is one of the proposed measures by which urinary tract infection can be prevented, no, by taking cranberry supplements. No, it can provide the benefit for us to reduce extra sugar, typically nga makita siya sa juice, and it is helpful. So another one of the proposed measures by which urinary tract infections can be prevented is that wipe front to back. Doing so after urinating and after a bowel movement helps prevent bacteria in the anal region from spreading to the vagina and urethra. So by wiping from front to back, specifically in the part of the anal region, so we can prevent the spreading of bacteria which from the vagina to urethra. Then if you have 2 or more infections in 6 months, consider talking with your healthcare team about recurrent UTIs. So your healthcare teams will review your medical history and medications, and with that, complete a thorough physical exams. So this is one of the proposed measures which urinary tract infections can be prevented. So it is important to be a hygienic, no, wipe front to back, specifically if manghihi ka, then dapat yato dyan itrapuhan sa part sa anal region, specifically, no, sa women, kay mas risk sila ani nga factor nga maka-acquire sila UTI because mas duol ang ilaha, ang anal dito sa urethra, na mas duol ang tube rather than sa women, rather than sa men as well, rather. So, it is common for some people to have bacteria in their urine but not experience any symptoms, no? Common siya nga na mga bacteria sa ato ang ihi but wala ta naka-experience og ato nga symptoms. So, daghan kay symptoms nga ato ang ma-experience if naata aning nga naka-acquired ta or naka-develop ta aning UTI or urinary tract infections. So, in these cases, no treatment is necessary. Why? Because wala tay mga symptoms nga na observe, no, na ato ang na-experience. But talk with your healthcare teams if you think you have a UTI. So one thing, if maka-experience ka ani, if ma-observe nimo nga nagsakit imong bladder nga part, tapos naghilo imong ihi, tapos strongly smelly ang imong urine, so dapat mo makapag-storya na ka, no? Makapag-storya na ka sa mga healthcare providers if basin og naa kay UTI. So you may need an appointment to discuss your symptoms and collect a urine sample. So as like to collect the urine samples, we have the urinalysis, the diagnosis, the urinalysis and urine culture to examine the level of your urine, no? I-examine na nila if sa imong ihi, if sa imong urine, if naa ba kay ato nga symptoms naa ba kay UTI. Then with that, you should seek medical attention if you develop a fever, chills, disorientations, or back or side pain. So these are the symptoms of UTI. So this could be signs of a kidney infection, no? Kidney infections, which requires treatment, or a systemic infections of the bloodstream that require hospitalization, no? Because pylori pertitis is very harmful, no? Extremely dangerous sa ato ang lawas, no? Specifically if maka-acquired ka ani, if ma-infected imong liver, daghan kaayong mga symptoms nga imuhang ma-observe or sa mga experience. So one of that is that the fever, no? Dayon back or side pain, tapos maka-observe na ka nga imong ihi kay naanay ka ng something dugo, tapos blood of urina, tapos budget ka ng something smelly kaayo ang imong ihi. So it requires treatment, so it has a systemic infections which requires hospitalization as well. So the most importantly nga dapat if acquired ka ani, moadto din ka sa hospital para ma-examine ang imuhang urine if naa ba ka urinary tract infections. So I hope that you've learned a lot from our discussion for today. So I think that's all, and thank you very much. So again, I am Jamel Macasibalyas, together with Kathleen Canilio and Consolacion Saira, the reporter for today's video recording report. That's all, and thank you very much. So the evaluations will follow. Goodbye, class. 1 hour. Mana ka?